मित्र आज तुमच्याशी मी क्रेनियल नर्व्स बद्दल चर्चा करणार आहे. क्रेनियल नर्व्स मध्ये अंडर ग्रॅज्युएट विद्यार्थ्यांच्या दृष्टिकोनातून दोन क्रेनियल नर्व अत्यंत महत्वाच्या, फेशियल नर्व 7th आणि ऑक्युलोमोटर नर्व 3rd आणि लास्ट 4 क्रेनियल नर्व बेअर ए पॅरालिसिस, वी कॉल इट एज बल्बार पॉल्सी. त्यामुळं पोस्ट ग्रॅज्युएटला सगळ्या क्रेनियल नर्व जरुरी आहेत, पण अंडर ग्रॅज्युएटला ह्या 3-4 प्रामुख्याने चर्चा होती परीक्षेच्या दृष्टिकोनातून. आणि त्यामध्ये सगळ्यात जास्त म्हणजे फेशियल नर्व. फेशियल नर्वची इन्व्हॅरिबली बेल्स पॉल्सीची केस शॉर्ट केस म्हणून विद्यार्थ्यांना देतात किंवा लॉंग केस म्हणून देतात. त्यामुळं फेशियल नर्व ही फार महत्वाची आहे. त्याची आधी आपण थोडीशी चर्चा करूयात. तर फेशियल नर्व इज ए 7th cranial nerve whose nucleus is in pons. आणि पॉन्स मध्ये दुसरं वैशिष्ट्य ह्या नर्वचं असं आहे की द फायबर्स ऑफ द नर्व दे बाइंड अराउंड द 6th nerve nucleus and come down. And after coming down, you find that when these muscles come down, it joins with the it goes to internal auditory meatus along with 8th nerve. I will repeat. 6th nerve nucleus, facial nerve nucleus is situated in pons, number 1. Number 2, it is laterally located, and then the fibers bind round the 6th cranial nerve and they join with the auditory nerve, 8th cranial nerve, and they enter into internal auditory meatus. After internal auditory meatus, they enter into auditory canal, and after auditory canal, they go to anterior aspect of the sternomastoid foramen, and after emerging out of the sternomastoid foramen, facial nerve supplies all muscles of the face, including scalp muscles and platysma. Now, this is the usual course of the facial nerve, and after knowing the course is very simple of the 7th cranial nerve, we should know that the important point is, I have already told you in my previous clinics that the nuclear lesion is always of lower motor neuron type, and therefore when you get a lower pons lesion which is nuclear or below, there you give it gives rise to lower motor neuron paralysis, commonly labeled as Bell's palsy. I also told you that if the lesion is above the nucleus, then we call it as supranuclear lesion. I may repeat that supranuclear lesions are always of upper motor neuron type, and if there is a upper motor neuron paralysis of 7th nerve, there is a bilateral innervation, cortical in nature, bilateral innervation. And if there is a bilateral innervation, naturally upper part of the face above the eye is not affected, while in lower motor neuron type you find that both upper part as well as lower part are affected. Mitra, everybody must know that how do you differentiate between upper motor neuron lesion facial palsy and lower motor neuron lesion of facial palsy. I will repeat that if it is upper motor neuron lesion, which is called as supranuclear, and commonest lesion, how you know, is in internal capsule, and therefore you get upper motor neuron facial palsy and hemiplegia, while lower motor neuron is nuclear and below. So in lower motor neuron lesion, upper part of the face as well as lower part of the face is affected. This must be remembered by the students. Then we find that These nerves, when this paralysis occurs, what are the situations where you get a facial palsy? I will cite one or two very important practical points which we have seen in our clinical practice. पहिली गोष्ट आहे बघा की तुमची सेकंड MBBS, फर्स्ट MBBS, थर्ड MBBS परीक्षा होते आणि परीक्षा झाली की नॅचरली विद्यार्थ्यांना आपल्या घरी जाण्याची तळमळ असते, रेस्टलेस, दे आर रेस्टलेस टू गो देअर होम. अँड मग त्यावेळेस काय करतो आपण, रेल्वेकडे विद्यार्थी जातो, रिझर्वेशन काढतो आणि रिझर्वेशन काढल्यानंतर नेमकं त्याला 3 टायर मध्ये मिडल बर्थ मिळतं आणि मिडल बर्थ मिळालं की ती खिडकी समोर येते आणि मग रात्रभर थकलेला असतो म्हणून झोपतो, थंड हवा चेहऱ्यावर येते आणि इन द मॉर्निंग the fellow develops lower motor neuron palsy called as Bell's palsy. I have seen 2-3 medical students developing this because of exposure to cold, and therefore point to be carried that exposure to cold is a common reason to develop facial nerve paralysis, namely Bell's palsy. दुसरं उदाहरण मी सांगतो तुम्हाला की ए वुमन is taking bath. She is taking a shower over her head, and then to dry her hairs, she sleeps under the fan. And when she sleeps under the fan, she gets a nap, sleep, and when she gets out of the sleep, she finds that her one-sided nasolabial fold is flattened, and there is a difficulty in talking also. And therefore, it is very clear that she has developed a facial palsy because of exposure to cold. So friends, these two examples are very adequate to know that it is exposure to cold which is responsible mainly for facial nerve paralysis. Now, after knowing this, the question comes, how to examine a patient. Bell's palsy has come आणि मग तो पेशंट काय म्हणतो, साहेब तोंडावरून हवा गेली आहे. That is the usual way these people speak to you. And then in that case, when you look at the patient, what happens? Now when you look at the patient, we find that on affected side, whether it is left or right, the nasolabial fold is flattened. So nasolabial fold is flattened and angle of law is at a lower level. Number 3, the food particle, they get locked up in the tooth and the cheeks and dribbling of saliva. So when you look at the patient, I find 4 things. One is flattening of the nasolabial fold. Second is that you find that there is this angle of the jaw is at a lower level compared to the opposite side, unaffected side. Third is dribbling of saliva from the angle of the mouth. And fourth is the food particles stuck up between the cheek and the tooth. So you look at him and it's a spot diagnosis. Then we go ahead for further examination. Then what I will do is ask him to look up and furrows over the forehead are seen. Now I will show you. For example, I am doing like this and you will see that there are a lot of furrows on both sides. आडव्या रेगा ज्याला आपण डोळ्यावर आपल्या कपाळावर आठ्या म्हणतो. And therefore when he looks up, there are wrinkles on both the sides of the face. If it is lower motor neuron facial palsy, friends, one half of the face is flat. Is flat. There is no wrinkle, meaning thereby that the upper part is affected. आणि खाली काय, अँगल ऑफ जॉ इज फ्लॅटेड. याचा अर्थ काय, याचा अर्थ वरचा अफेक्ट झालाय आणि खालचाही अफेक्ट झालाय. And when you get involvement of upper and lower part, what type of lesion it is? It is obviously a lower motor neuron type of lesion. So when you start examining, ask him to look up and look for the furrows over the forehead. After that, you ask him to close the eyes tightly, and you will find that the unaffected eye जो नॉर्मल आहे तो पूर्ण बंद होतो, परंतु इकडचा थोडासा अर्धा राहतो आणि अर्धा बंद होतो. So when you look at the patient, you find that he cannot completely close the eye. मग आता 7 नर्व पॅरालिसिस मध्ये पुढे काय करावं? पुढे काय करावं? पेशंटला दोन्ही डोळे पक्क बंद करा म्हणावं, आणि बंद केल्यानंतर आपण आपल्या हाताने अपर लीड अशी वर करायचा प्रयत्न करायचा. आता नॉर्मली आपल्याला दोन्हीकडे जोर द्यावा लागतो वर करायला. Now, in a patient who has got facial palsy, on the healthy side, it is difficult to raise, while on the affected side, easily आपल्याला वर पापणी करता येते. Upper lid can be taken up quickly, and that is a important sign. And when you do that, you find that there is a rolling up of the eyeball. Eyeball, the eyeball is rolled up, and this is called as a Bell's phenomenon. This is asked in oral. What is Bell's phenomenon? So Bell's phenomenon is that in a patient of facial palsy, when the upper lid is lifted up, there is a rolling of eyeball which goes up, is called as a Bell's phenomenon. त्यानंतर मग काय करायचं? पेशंटला म्हणायचं की तोंडात हवा भरा. आय विल शो यू एक्झाम्पल. आणि मग जिथं मोठा भाग आहे तिथे दाबायचं. ज्या ठिकाणी पॅरालिसिस नाही तिथे तुम्हाला लवकर बंद होत नाही, निघत नाही हवा, पण अफेक्टेड साइड मध्ये थोडी दाबलं की हवा बाहेर येते. This is how, this is again a one test which can tell you the involvement of the facial muscles. Second is, त्याला शिट्टी वाजवायला सांगा. He cannot whistle. And that is again a sign that facial muscles are involved. मित्रो, facial nerve नुसती facial muscles सप्लाय करत नाही, तर स्काल्प मसल्स आणि प्लॅटिझमा हे सुद्धा फेशियल नर्व सप्लाय करते. आणि फेशियल नर्वचा स्मॉल पार्ट ऑरिकल कानाचं असतं, त्या ठिकाणी सुद्धा त्याचा सप्लाय होतो. आणि त्यामुळं काही पेशंट्स मध्ये बिहाइंड दी इयर देर समटाइम्स देर इज ए पेन ॲज ए प्रेझेंटिंग फीचर. मग हे तपासल्यानंतर आपण एक्सटर्नल ऑडिटरी मीटर्स बघायचं, आणि मग तिथे इन सम केसेस वेर देर इज फेशियल पाल्सी, देन इन दॅट केस यू मे गेट स्मॉल रेज्ड थिंग. तुम्हाला माहिती आहे की मेडिसिन स्किन मध्ये देर आर फोर नेम्स. The names are papule, macule, vesicle, and pustule. The dermatologist will explain you everything. I will only tell that what is vesicle. Vesicle म्हणजे it is raised above the skin, आणि त्या ह्याच्यामध्ये पाणी असतं. जर पस निघाला तर इट बिकम्स पस्ट्यूल. नुसतं पाणी असेल तर इट बिकम्स वेसिकल. आणि एक्सटर्नल इयरच्या मेडिएशन मध्ये इफ यू गेट अ वेसिकल्स एक्सटर्नल, तर इफ यू गेट अ वेसिकल देअर इट इंडिकेट दॅट दिस इज लाइकली टू बी herpes zoster. Herpes zoster is a viral infection of the nerve, and it indicates herpes zoster. This herpes zoster can involve geniculate ganglion, and when the herpes zoster involves geniculate ganglion, this is a syndrome, and that syndrome is called as Ramsay-Hunt syndrome. So point I am carrying with you, everybody will not be asked this syndrome, but point is that you must examine external meatus to find out where there are vesicular lesions, right? And then after that, patient has now I will tell you later on the various lesions which can occur in facial nerve. There is one muscle called as stapedius. this stapedius muscle is supplied by a branch of the facial nerve, and if the facial nerve proximal to stapedius nerve, then you get paralysis of the stapedius nerve. And if you get a paralysis of stapedius nerve, what will be? Then I will again talk to you when I talk about localization of lesion. So stapedius paralysis जर असेल तर आपल्याला कानाची तपासणी करावी लागेल. Some of you must have completed ENT posting, some of you will be going. There is one test called as audiogram, and that audiogram will tell you whether there is a diminished hearing which may occur in cases of involvement of the facial nerve. Then we come to external ear examination, where you may find there is a otitis media, kanatun poo yeto. That also can lead to involvement of a facial nerve. So, to sum up, physical examination I have told you 6-7 points, and then we talk about external meatus, then we talk about the pus through the ear, and then we also do audiogram to find out there is diminished hearing. If there is a herpes zoster involvement of a geniculate ganglia called as Ramsay Hunt syndrome. तर मग आपली फिजिकल एक्झामिनेशन झाल्यानंतर मग आपण लोकलायझेशन ऑफ लिजन मध्ये जाऊ. आपण तपासणी केलीमध्ये मग आपल्याला दिसून आलं की कुठे लिजन आहे. आता लिजन कुठे कुठे असू शकतात? पॉन्स मध्ये असू शकतात. सुरुवातीला आपण पॉन्स घेऊ. आता पॉन्स मध्ये न्यूक्लियस इज ऑफ फेशियल नर्व, आणि त्या फेशियल नर्व बरोबर आपल्याला सिक्स्थ नर्व मिळते, ॲब्ड्युसेंट नर्व. आणि ज्यावेळेस न्यूक्लियर लिजन असतं ऑफ फेशियल नर्व, इन दॅट केस यू ऑल्सो गेट इन्व्हॉल्वमेंट ऑफ दी सिक्स्थ नर्व. त्यामुळे पॉन्टाईल लिजन मध्ये आपल्याला काय मिळेल? लोअर मोटर न्यूरॉन फेशियल तर मिळेलच, पण इन ॲडिशन you will get involvement of sixth nerve, and sixth nerve is abducent nerve supplying lateral rectus muscle, and therefore ask him to look to the side, and if you find that the eyeball cannot reach to the corner, there is a white of eye seen, and that tells you that there is involvement of the sixth nerve. So nuclear lesion मध्ये sixth nerve paralysis and seventh nerve paralysis अशा मिनिमम 2 cranial nerve इन्व्हॉल्व होतात. आणि मागे मी तुम्हाला म्हणाल होतो की इफ देर इज अ न्यूक्लियर लिजन, लोअर मोटर न्यूरॉन टाइप, यू गेट fasciculations. So you may or you may not get fasciculations over the face, which may help you to find out that the lesion is in the level of pons. I will repeat. The lesion is above nucleus. It is an internal capsule. Then what type of lesion you will get of seventh nerve? Obviously, it will be upper motor neuron type because it is supranuclear. If it is a nuclear or below, we get a lower motor neuron type of lesion. So, we have talked about the pons, and then after pons, you know that the nerve along with eighth nerve goes through auditory canal. I have told you. And in auditory canal, we have got 3 nerves. The first nerve is greater petrosal nerve, great petrosal nerve, which is responsible for lacrimation. Second is nerve to stapedius, and third is chorda tympani. मित्रांनो लक्षात ठेवा, proximal lesion असेल तर naturally that nerve will be get involved, and therefore these would be the 3 levels where you will get a localization of lesion. आता प्रश्न कसा येतो की ग्रेटर पेट्रोजल नर्व अफेक्ट झाले. आता ग्रेटर पेट्रोजल लॅक्रिमेशन इज अफेक्टेड. मग हाऊ डू यू नो? अँड दॅट इज कॉल्ड अ शर्मास टेस्ट. नाव सोडून द्या, सिंपल आहे. ब्लॉटिंग पेपर घ्यायचा आणि बिलो आयलिड ठेवायचा. जनरली 10 मिनिट ठेवतात, पण 5 मिनिट ठेवलं तरी चालतं. आणि ते ब्लॉटिंग पेपर किती भिजला हे पाहायचं टेअर्समुळं. आणि नंतर अमोनिया इनहेलेशन द्यायचं पेशंटला. अमोनिया दिली की it stimulates the tears, and therefore we find that when you give ammonia, instead of the earlier thing, there is a diminution in the size because lacrimation it becomes defective, and therefore this would be a Sherman's test in reference to great petrosal nerve. Then we come down, and that is chorda tympani. Now, chorda tympani is responsible for test for anterior two-thirds of the tongue. And it is interesting, how do you test? Lot of mistakes by the student. Now, काय करतात, जीभ तोंडामध्येच राहते आणि मग त्याच्यात साखर किंवा सॉल्ट आपण टाकतो, साखराचा थेंब टाकतात, जीभ हलते, जीभ हलली की ती टाकलेली साखर दुसरीकडे जाते, afferents go in different way, and therefore always remember that when you test sugar, you take a gauze piece and the tip of the tongue hold आणि ती थोडीशी बाहेर ओढा, so that you can put the drop on the dorsal surface of the tongue. आणि मग पेशंटला आधी सांगायचं, लक्षात घ्या की गोड लागलं तर उजवा हात वर कर, खरट लागलं तर डावा हात वर कर. Explain to the patient. If you do not explain, then we don't know what he is feeling about. How do you know test? He has to tell, and he cannot speak, and therefore by gesture he can tell you whatever, whether he is getting sweet or whether he is getting salty. So salt and sugar are generally used. Some people use citric acid, and this is how you do the test of chorda tympani, which carries taste sensation from anterior two-thirds of the tongue. Okay, so we have talked about three nerves in auditory canal, and then we may come down. And when you come down, upper level मध्ये एक राहिलं बघा की न्यूक्लियर लिजन झाल्यानंतर you get a cerebellopontine angle. I have talked to you earlier. When you get cerebellopontine angle, what are the structures involved? You get a fifth nerve, you get the eighth nerve, and you get a seventh nerve, plus minus cerebellum. I will repeat, कारण तीन न्यूक्लियस असतात पॉन्स मध्ये, कोणकोणते? फिफ्थ, सेवन्थ अँड एट्थ. या तिन्हींवर इन्व्हॉल्व होतात, प्लस सेरेबेलर सायन्स येतात, which I have talked in details to you. If you get all these pictures, slowly growing tumor, it will be cerebellopontine angle tumor. Now coming back to lower one, that after, then we come to the geniculate ganglion, and I told you that in geniculate ganglion, if you get involvement by herpes zoster, you get a syndrome called as Ramsay-Hunt syndrome, and you get a facial palsy. After that, we come to stylomastoid foramen, and then over the face, all muscles of the face are involved in reference to the Bell's palsy. Very, very simple. And therefore, to repeat, localization will be pons, cerebellopontine angle, and then auditory canal. Auditory canal मध्ये तीन, great petrosal, chorda tympani is the second one. And after knowing this, we come to after I already told you, we come to investigations. Investigations मध्ये एक लक्षात घ्या की सर्वात महत्वाचं इन्व्हेस्टिगेशन जे आहे ते डायबिटीस आहे का. कारण असं म्हणतात की 30 पेशंट मध्ये डायबिटीस हा रिस्पॉन्सिबल आहे इन रेफरन्स टू बेल्स पाल्सी, आणि बाकी इन्व्हेस्टिगेशन अकॉर्डिंग टू द कॉज आय ऑलरेडी टोल्ड यू. सो बेल्स पाल्सी म्हणजे काय? आधी आपण म्हणत होतो what is the reason of paralysis of facial nerve. The reason of one is cold exposure, and second is causes are plenty, and when you do not know anything, we call it as idiopathic, and therefore idiopathic, autoimmune, herpes zoster, and parotid tumor, otitis, all these are the situations where you will get involvement of the facial nerve. त्यानंतर आपण हे बघूया की युनिलॅटरल फेशियल नर्व कॉमनली असते. 90% of patients मध्ये you get unilateral facial nerve paralysis, but rarely you may get bilateral. That is called as bilateral facial palsy. This is not asked to undergraduate student, but is always asked to a postgraduate. Okay, what are, tell me two conditions where you get a bilateral lower motor neuron type of facial palsy. And commonest example is Guillain-Barré syndrome. Remember it, very simple. Guillain-Barré syndrome. And second is sarcoidosis. Not important for undergraduate. But postgraduate, yes. And therefore, sarcoidosis and Guillain-Barré syndrome. And there is some still Leventhal syndrome, which is again not for undergraduates. So these are the two situations where you may get bilateral lower motor neuron type of facial pulse. At the tail end, we come to management. Now, मित्र लक्षात घ्या की more than 50% of patients recover completely. And therefore, if somebody develops facial palsy, you should do good counseling. Tell him that there is nothing to worry and you will be all right within 2 to 3 weeks. Most of them recover. Some of them take a little longer time and some develop some residual paralysis. So, if I find that he develops facial palsy and he comes within 3 days or he comes on the very next day to you, then what do? There is edema and therefore you give cortisone in the form of prednisolone. And latest thinking about Bell's palsy as per PCR examination, they say that it is herpes simplex infection, infective etiology. Bell's palsy is said to be due to herpes simplex and therefore antiviral drug and common drug is acyclovir. And therefore, if the patient comes within 3 to 4 days, ideal treatment will be giving prednisolone and acyclovir with a very good results. Remaining treatment will be physiotherapy, which I always say that physiotherapy is the right hand of a physician, and electric stimulation. So electric stimulation, physiotherapy are supporting things in the treatment of Bell's palsy. And therefore, friends, remember that Bell's palsy is a lower motor neuron type of involvement where the lesion can be in the pons, which is called a nuclear lesion, and lower down. And in nuclear lesion, you generally get 6 nerve palsy plus fasciculations. While in this auditory canal, I told you that there are 3 nerves which are responsible for examination purpose. And then we come to cerebellopontine angle. And lower down, we come to geniculate ganglion, where you can get a herpes zoster, which I already explained to you. And then come to the face. In the face, there can be parotid tumor, malignancy of the parotid gland can give rise to otitis media, can give rise to facial palsy, which I have told in detail. How do you examine a patient of Bell's palsy or a facial nerve paralysis? Seventh nerve being very common is important for students to know. Now, next time we will be thinking about oculomotor nerve and last 4 cranial nerves in our clinical discussion. Thank you.